maybe a complication will be there. And we also, as a pharmacist, in terms of maybe adjusting the medication or educating the patient or supporting the quality use of medication in general, this, I think, one of our main scope of focus when dealing with our patient. So I will start in the next section to talk about the individual antidiabetic drugs, and at a glance what we can consider. So what about insulin? Insulin in general, during any acute illness, insulin requirement will be high. When we talk about insulin adjustment, we talk about monitoring the blood glucose level, we talk about the adjustment of dietary carbohydrate intake. In general, we talk about insulin adjustment. This should be, of course, direct medical supervision, and in all cases should not be stopped in patient with intercurrent illness unless other maybe consideration are there. So normally, and I think the references, the detailed references for this one, I provide at the end of my talk. In patients with type 1 diabetes, usually if they will have this maybe severe hyperglycemia, and usually they might need supplementary doses of short-acting insulin. In case those with hyperglycemia, you can consider reducing insulin to 10 to 20%. But maybe, as I mentioned, hyperglycemia is much more common when the concomitant infection is there. Patients with type 2 diabetes, hyperglycemia increment in insulin requirement by 10 to 20%, and consider more frequent monitoring for those patients at time of acute illness compared to before or without infection. The second one, metformin. Metformin, I think in most of the clinical guidelines, the Malaysian guidelines, I think maybe in Indonesia will be the same, I think. This worldwide first choice or preferred choice for antidiabetic due to many reasons. Efficacy, maybe lower hypoglycemic risk, favorable effect on the weight loss. But what we can see in especially in hospitalized diabetic patient with COVID-19, usually metformin can be considered to be temporarily discontinued. Risk of dehydration, risk of worsening renal function, risk of acute metabolic complication. All these can bring the consideration to temporary discontinue metformin in the clinical setting into action. Of course, also all of maybe those maybe working on diabetes, they know, of course, the medication-induced GIT symptoms is quite troublesome, and can even sometimes aggravate the risk of dehydration in a given case, and this dehydration will be linked further to worsening in the renal function. So this one should be maybe cautiously considered. And the pharmacist, I think, in the education for the patient coping with the proper management of the GIT symptoms will be quite helpful. Glycoside is also a common medication, and maybe is associated by risk of hypoglycemia. And as I mentioned, it is not the main risk among diabetic patients. And if hypoglycemia, of course, the dose reduction will be there. Hyperglycemia, which is more common, can mandate or can maybe necessitate increase in the glycoside dose to be there. And of course, those patients, when they have current infection, they have to be considered for more frequent blood glucose monitoring for adjusting the dose to be continued. The DPP4 inhibitor, I think this one, if you hopefully remember from the specific mechanism of COVID-19 and diabetes, we have this one. We have the DPP4 inhibitor, the medication itself. By the theoretical maybe hypothesis, they have to be to show anti-inflammatory effect. But this anti-inflammatory effect of additional benefit for COVID-19 inflammatory pathway, the exact clinical benefit remains uncertain. Right now, there is no recommendation to give DB4 to help to cater for the inflammatory pathway in COVID-19. DB4 also, in the literature, there's so many reports about those taking DB4 will be at increased risk of infection. But usually, this is not supported by many robust evidence. And one of the recent meta-analysis to assess whether it is maybe increased risk of the respiratory tract infection among those diabetic patients on DB4 found no increase in the risk. So at this point, DB4 inhibitor related to the infection at the time remains controversial. And the recommendation actually is maybe DB4 inhibitor is generally well tolerated and should be continued. Of course, one of the area for those interested in research, one of the area to work on diabetes medication in COVID-19 to test on maybe possibly larger data on the exact clinical benefit for the anti-inflammatory action for DB4 in COVID-19 patients. One of the newer medication, SGLT2 inhibitor, also they have maybe anti-inflammatory effect. They have, of course, one of the cardiovascular and renal outcome associated. They have benefit, protective effect on the cardiovascular and renal. But as we mentioned in Metformin before, in the time of acute illness, it is quite risky to continue SGLT2 inhibitor because of the gastrointestinal discomfort, the dehydration, loss of appetite, and this would be wise to temporarily discontinue this medication in the presence of infection in those hospitalized diabetic patients. And we can also highlight that this medication, as all of us maybe recognize as a main side effect, they already predisposed to euglycemic DKA, and they already increased risk of the urogenital infection, particularly among the females. So we have to consider about the SGLT2 in COVID-19 patients, especially female. Pioglitazone, one of the common medication also, but associated with fluid retention. It is not that good for especially diabetic patient has heart failure. Also, it predisposed to weight gain, and at the time of the pandemic and less exercise and disrupted dietary profile, say that maybe pioglitazone can be one of the least recommended option for COVID-19. I think the last one, the glucagon-like peptide one, GLP-1 receptor agonist. It has cardiovascular renal outcome, a low hypoglycemia risk. It has minimal impact on weight gain, which all are good. But still, it has DKA, diabetic ketoacidosis incidence, especially with exenatide and liraglutide. Still, the gastrointestinal symptoms that we have highlighted before with metformin still can occur. A risk of acute pancreatitis is still there, although recent meta-analysis among diabetic patients doesn't support. But in general, in patients with maybe DKA, which is common among patients, especially with type 1 or patients with severe infection of COVID-19, they most likely they have some sort of severe hyperglycemia or DKA. If DKA or pancreatitis, the medication should be discontinued and the patient should be referred to seek medical consultation. So in short, just to summarize all what we have mentioned about the drugs, because I'm afraid that maybe you were overwhelmed by all these points. Here, I just maybe comment or communicating the expert panel recommendation that was published in Lancet of Diabetes and Endocrinology. What actually we